Hello everyone, I'm Dr. Sridhar. I'm a senior consultant in the department of OBG at Fortis Bannerghatta Road. Today I'm going to talk to you about diet in pregnancy. Now, pregnancy is such a joyous occasion in any family. So the minute a lady says that she's pregnant, then she'll be getting a lot of advice from everyone, whether it is her parents, sisters, cousins, aunties, neighbors, friends. Everyone has a piece of advice so that the pregnancy culminates into a joyous occasion. We basically need a healthy mother and a healthy baby at the end of pregnancy. So a lot of suggestions keep coming from various ends regarding you should eat this, you should not eat this, this is what you should do about your diet and all that. So many of the pregnant women are very confused as to what to eat and what not to eat. So the basic mantra is that you can eat all the foods that are available as long as they are not very spicy and oily. That is one. And second is it should not be sugary. So why is it important that you avoid spicy oily diet, especially in the early pregnancy and the later part of pregnancy? Because it can lead to gastritis, and with gastritis there is a lot of nausea, vomiting. We don't want that to happen. So that is the reason we try to avoid a spicy and oily diet. The next thing is sugary diet. Sugary diet is also avoided because as Indians, as a race, we are more prone to gestational diabetes. If you look at the general population, 1 in 8 are diabetics. So we are prone to gestational diabetes in pregnancy, so we should try to avoid sugary diet. So now regarding the other fruits and vegetables, every fruit can be consumed, all in moderate quantities. So fruits like mangoes, jackfruit, which are very high in sugar content, they should be consumed in moderate quantities. But the rest of the fruits like oranges, apple, every day you can have 1 or 2 of the fruits. And there is a common myth that is propagated that you cannot have pineapple or papaya. Many people think that papaya and pineapple can lead to spontaneous abortions. This is a myth. It is not true at all. If this was true, then we would not have an entire pharma industry dedicated for helping women to abort pregnancies. So this is not at all true. And if you don't like eating that fruit, you may stop eating it. But otherwise, you can easily consume all these fruits. Now, regarding vegetables also, many people say that, think that, certain vegetables cannot be consumed. All vegetables can be consumed, but vegetables like beetroot and all which are high in sugar content, you should have moderate quantities. But otherwise, green leafy vegetables, then dates, raisins, and then pomegranate, figs, all these are extremely good in pregnancy because they improve the iron content in the blood. So this way throughout pregnancy you can have a normal healthy diet. I always tell my patients that you should not be eating too much of junk diet. When we say junk, burgers, fries, pizzas, all these things can be taken maybe once in a while, maybe once in a month. Even chocolates and ice creams, pastries and all this, they should not be taken on a regular basis because they are very high in sugar content and the nutritive value is very less. So these sort of food can be taken maybe once a month or once in 3 weeks. You can take a small piece, but other than that, you should not be taking too much of them. Another misconception is that as the pregnancy nears for delivery, when they are very close to the delivery date, many women think that eating a lot of ghee will make the delivery easy and the entire process easy. Once again, this is a myth. It is not that the minute you take ghee, the ghee will go and line the birth canal. That it doesn't work like that. So by taking too much of ghee, you will end up having, putting on a lot of weight, which will become difficult to shed. Similarly, post-delivery, after the delivery, many women think that they cannot eat certain foods because that will get transmitted in the breast milk and hence the baby will suffer. You have to remember that food taken by the mother is broken down into basic molecules like proteins, carbohydrates and lipids, fats. So that goes to the baby rather than a mango or a jackfruit or a pineapple going to the baby. Medicines you should be careful because that can be transmitted in the breast milk, but otherwise wholesome, healthy diet, home cooked meals is what you should take in both pregnancy and after delivery. Thank you very much.